You know, there comes a time when someone might want to, lose some weight, but they can't. It could be medical conditions or whatever, they just can't stick to a diet. They have to turn to bariatric surgery. Well, when you need to do that, you come see this gentleman, one of the general surgeons here, Singing River Health System, the Ocean Springs officer. Dr. John Hall, how are you?
Good, sir. How are you?
I'm fine. And Singing River Health System awarded #1 in Mississippi for patient safety in bariatric weight loss surgery by CareChecks. Congratulations.
Thank you, sir.
That's an offer. Give us a little background about yourself.
So I'm from Ocean Springs. I was born in this hospital, actually. I graduated class of '99. Went to University of Southern Mississippi for undergraduate. From there, I went to graduate school at Baylor and did my medical school, residency, and fellowship at University of Texas of Houston.
Okay, and then had the opportunity to come home.
Did so, yes, sir.
That's great. So let's talk a little bit about bariatric surgery. As far as how do you know when how does someone qualify for something like that? I mean, you have some different types of surgery for, I guess, obesity?
Correct. So largely, it's based on your BMI, which is a ratio of height to weight. Patients who are 35 to 40 will qualify if they have medical comorbidities. Patients 40 or greater will qualify even without medical comorbidities. We do offer other procedures that are meant for BMIs that are lower, 30 to 40 actually for the Orbera balloon. Patients will gravitate towards that if they don't want any incisions but still want to lose weight with additional help. And then we offer low BMI sleeve gastrectomies as well for patients who have a BMI of 30 to 35.
Talk about some of the different surgeries as far as what are the procedures like?
So by and large, the patients won't notice much of a difference in time. That's a frequent question. But the three main operations that we provide would be a Roux-en-Y bypass, which is what we would consider a restrictive and malabsorptive procedure. And then there's a sleeve gastrectomy, which is sort of a restrictive procedure. And then the Orbera balloon, which is a balloon we place in the stomach. And the idea is that it creates a sense of satiety and helps people with better eating habits overall.
Kind of makes you feel like you're full.
Correct.
So it kind of cuts out, you eat a little bit and it's like, wow, I had 2 peas and I'm fine.
Correct. Well, maybe not that extreme, but yes, that's the idea.
I know I'm being facetious and exaggerating a little bit there. But along that line, it does cut back the desire to eat.
Correct.
Which is something. And then afterwards, after the surgeries, I know that you stay in contact with the patients, and you want to make sure that they're doing things right. So you don't want to see them again as far as having to do another surgery. But you stay in contact with them. Correct.
And that's actually a big part of what makes a program successful is the preoperative and postoperative care. All three of the surgeons do the same operations. We all have really good staff that helps us with our preoperative and postoperative care. But maintaining the weight loss and having a good outcome is really based on interaction with our nutritionists, with our nurse practitioners, with our coordinators, and the surgeons postoperatively to make sure that you're on track.
I read a recent article about a patient that you had that could not eat a meal for 4 years. That seems strange.
Well, every surgery can have a complication. And in her case, she had a complication such that she couldn't eat because in doing so would further the complication. She would get this intra-abdominal infection. So I happened to be on call one night, and that's how I got introduced to her. And I was able to fix her, and now she's actually doing very well. She's able to maintain a relatively normal life. She's eating, she's gaining weight, and she's out in the world doing normal activities.
Wants to do. And that's one of the big things too, is whenever your goal is to help these people get a regular life back, whereas being obese or something like that, their life is limited. The things that they can do are limited.
It really is. Yeah, I think a lot of people think of bariatric surgery as weight loss surgery, but realistically it can be thought of as endocrine surgery. Originally it was made for people with hypertension, and all the iterations of bariatric surgery since then have been with the idea of reversing diabetes and keeping people off of their blood pressure medication. So if your lifestyle is limited or you find yourself having complications because of those medical problems, then bariatric surgery is probably the right decision for you.
And again, whenever they do decide that they need bariatric or surgery, Do they need to go see a general physician first and get recommended to you?
No, absolutely not. If you just were to Google SMS weight loss, will pop up, and you just fill out the online form and take it from there. That's usually
And they come in for a consultation.
They do, absolutely. And we offer a much more comprehensive weight loss program than just surgery. We have a medical weight loss as well. We have a very good staff who will figure out for you what's your best option and help you down that pathway.
And of course, one of the surgical tools that you use is the DaVinci Unit,
Right.
which we've come to seen a lot of these things here at Senior River Health System in the different facilities here in Ocean Springs, Pascagoula, and seen those things and how they work, and it's amazing. Does that make it a lot easier for you as a surgeon?
I wouldn't say that it makes it easier, but on revision cases like complicated patients, it certainly does. It is a nice tool to use for consistent results.
Right.
And it does allow dissections and certain procedures to be much, much easier.
Now, again, if someone wants to find out if they are a candidate, and I'm sure there are, as you mentioned, it depends on the BMI of the body as far as what type of surgery that you would recommend to them, bariatric surgeries.
Well, just schedule the consultation, come to our office, and be happy to have that discussion.
Okay, all right, and of course you do that here at Ocean Springs.
I have most of our bariatric patient interactions happen here at Ocean Springs. Every once in a while I'll see somebody in Pascagoula at our Pascagoula office, but we by and large try to keep everything within the same frame. That way we have the consistent results that have gotten us that level of accreditation.
Now, they don't have to live in this immediate area,
Absolutely
do they?
not.
I mean, if they
Absolutely
live
not.
in Hattiesburg or somewhere out, out of the area, and they see this program and they want to, find out information, you'll take them.
Absolutely.
Okay, and as far as insurances and
So some insurances do have certain requirements to meet the criteria to undergo the surgery. We'll help you figure out if your insurance is covered with bariatric surgery. If it's not covered, there are options. There are the cash pay options. We have a low BMI and a cash pay option with the idea that we're trying to keep people from going out of the country for their bariatric surgeries. What I think most people don't realize when they do something like that is that any complication that you have after that surgery is not covered. So if you come back to the States and you have a complication that needs to be fixed, your insurance company won't fix it.
wow.
That's a large bill. If you go,
I'm going to cut you off because we're about out of time,
okay.
Dr. Hall. Thank
All
you very much. If you want some more information, as he said, go to the website or give them a call, set up an appointment here with Senior River Health System.